Hello everyone, this is Dr. David St. Jean. Thank you for tuning in and checking out this video. The goal here is to explain to you what chiropractic medicine is and how it can really benefit you and your loved ones. Now, I would love to be able to sit here and tell you that chiropractic can be explained in a brief elevator conversation with just one or two sentences. However, that's just not the reality of it. The profession is much more complex and really deserves a bit more of a detailed explanation. I'll do my best to keep things concise, yet informative, as I know, as well as you do, that time is precious. So let's begin. The chiropractic profession evolved as an alternative healthcare profession that began by successfully treating a wide variety of ailments. A lot of people think chiropractor, back doctor, or spine specialist, and that is true to some extent, but we didn't really start just by treating the back. We treated a lot of different things. Now, as insurance began reimbursing chiropractic in the late 1960s, 70s, it became almost vogue to report only neuromusculoskeletal disorders to those companies. However, the chiropractic profession at large continued to treat chronic degenerative disorders and somatovisceral dysfunctions, in addition to the self-limiting neck and back pain conditions. Now, for simplicity in billing for third-party reimbursement, chiropractors began documenting only their care for structural disorders. And this method proved far less complicated than attempting to educate an unseen third-party payer about how the relationship of a properly functioning nervous system would promote optimal health. And this is really where the chiropractic industry began milking the insurance cow, if you will. And to a large extent, where we became known as back crackers and spine specialists more than before. It really was self-induced, if you think about it. Well, as always, times have changed, like anything. And now that managed care has constrained the economic rewards by restricting the once autonomous rights, it seems as though chiropractic has come full circle. And this is a good thing. This is a very good thing for the profession, for the physicians within it, and most importantly for the patients. The profession is currently reverting back into our original vision as preventive, non-drug, non-surgical, whole body and integrative in nature. In fact, the profession has also become quite diverse. Nowadays, you have several options when it comes to choosing your chiropractor. You can find a traditional musculoskeletal doc who focuses largely on musculoskeletal conditions and spinal conditions. Or you can look to a more eclectic physician who maintains more of a primary care, whole body focus. In addition, several specialties have emerged in chiropractic, ranging from chiropractic orthopedics to chiropractic neurology or functional neurology, sports medicine rehabilitation, chiropractic radiologists, and internal medicine docs, to name just a few. Now, personally, I practice with a whole body integrative approach that utilizes everything from nutrition, functional medicine, movement and exercise, to your more traditional musculoskeletal medicine and more advanced neurological rehabilitation and brain-based therapy. My specialty lies in the diagnosis, treatment, and management of certain chronic degenerative conditions. However, I still maintain a passion and level of expertise for the traditional musculoskeletal-based pathologies. Now, this hopefully helps you understand where our clinic and where I fall into in regards to the spectrum I'm discussing with you here of chiropractic medicine. I hope it also, highlights and sheds some light on what chiropractic medicine is for you. Now, a lot of people are always wondering, is chiropractic treatment safe? And this is a very common question in our industry. Specifically, most patients seem to be concerned with manipulation of the neck. And rightfully so. This is a very sensitive, vulnerable area of your body, which houses several extremely important and vital structures. However, let's step back for a second and shine some light on the safety of chiropractic treatment in general with the use of facts and research instead of hearsay and malicious marketing. Now, although chiropractic has an incredibly safe record, and it's important for you to know that no health treatment is completely free of potential adverse effects. I'm going to repeat that because this is a very important point to drive home. Anytime you step foot in any kind of medical office or facility and you receive any type of treatment, there are going to be inherent risks to that treatment. You cannot escape that. Now, the risks incurred by the patient with chiropractic treatment are very, very minute. I mean, extremely minute. And the risks are stratified from adverse effects causing mild discomfort to those which may cause, significant injury. Now, current literature shows some individuals may experience mild soreness, stiffness, or aching following chiropractic treatment, similar to what you might feel, after exercising intensely, or maybe you worked out really hard with a personal trainer. This mild discomfort typically fades within a 24-hour period of time. But let's now shift our attention and focus to really what everyone wants to know when it comes to the safety of chiropractic, and that is the neck adjustment or cervical manipulation. What is the safety of this procedure, you're wondering? Let's first discuss what it is. Cervical manipulation is utilized for various reasons, and largely depending on the education and specialty of the chiropractor at hand. But most commonly, this therapeutic intervention aims to improve joint mobility and restore range of motion, thereby reducing muscular hypertonicity within the area and helping to relieve pressure and tension within the area. Now, despite public opinion, cervical manipulation is remarkably safe. It's a remarkably safe procedure. Now, while limited reports have attempted to associate upper cervical high-velocity manipulation or neck adjustments with a certain kind of pathology which causes stroke, known as a vertebral artery dissection, again, it's a vertebral artery dissection, evidence suggests this type of arterial insult often takes place spontaneously. In fact, everyday activities such as turning your head while you're driving or swimming, or even having let's say, a shampoo treatment in your hair salon where you extend your neck backwards, that can cause a vertebral artery dissection. And oftentimes, a patient with this condition will experience headache and neck pain, which leads them to seek professional attention, often from a chiropractor or a family physician. But the actual care is not the cause of the injury, believe it or not, most times. The best evidence indicates the incidence of arterial injuries associated with high-velocity upper cervical manipulation or neck adjustments is extremely, extremely rare, affecting approximately one case in 5.85 million. Now, if you look at the graphic illustration on the screen, it further illustrates the safety of chiropractic medicine by contrasting the risks associated with other common medical procedures and other common day-to-day activities. Now, if this graphic illustration didn't shock you enough, let's just look at some eye-opening statistics relevant to what most of society is largely unaware of. 2,000, think about that for a second, 2,000 people die every single week from reactions to medication. That's from the Yale New Haven Hospital study. Nearly 1,000 more people die every single week from unnecessary surgery, and that is from the Johns Hopkins study. 30,000 people are hospitalized every week from reactions to medication. That's, again, from the Yale New Haven Hospital study. So just for medications alone right there, step back for a second and think every week 32,000 people are becoming affected in some way, shape, or form. Now, 67% of all over-the-counter drugs do not do what their promoters say they do, according to a 13-year study conducted by the U.S. Office of Public Health. Overall, folks, chiropractic is a comprehensive and safe healthcare profession that addresses the wide variety of factors that impact human physiology, biochemistry, and metabolism. The profession specializes in natural, non-invasive healthcare, and the clinicians are trained to use a full range of medical diagnostic tools and a wide array of effective treatment options. Now that's why chiropractic physicians now should not be considered just back doctors. They're much more than this. They're more than back doctors, more than spine specialists. We focus on whole health integrative healing and consider a wide range of factors that may impact your health, ranging from biomechanical dysfunction, biochemical imbalances, genetics, trauma, microorganisms, your nutritional status, your exercise status, how well you're sleeping, posture, your environment, both internally and externally, your mindset, as well as stress levels. I hope that this brief discussion gave you the information you might have been looking for in regards to what exactly chiropractic medicine entails, what it is, how it can actually benefit you, and the safety overall of it. This is Dr. David St. Jean from the Neurometabolic Center of Chicago. Thanks again for tuning in. If you'd like some more information and you want to find out how we can specifically help you, log on to our website at drstjean.com, or you can contact us via email at info@drstjean.com or phone at 312-869-9780. Thanks again for listening. Take care. Bye-bye.